What if I told you that the results of your next blood test could be completely wrong? Not because of a mistake in the lab, not because of faulty equipment, but simply because of something you did the night before, or even just a few hours before sitting down in that chair. Wouldn't you want to know exactly what not to do so you don't end up with a misdiagnosis that could change your life? Blood tests are considered the backbone of modern medicine, especially for seniors over the age of 60, because they reveal silent problems that even the most skilled doctor cannot detect during a normal checkup, from blood sugar levels and kidney health to cholesterol, thyroid function, vitamin deficiencies, and even signs of infections or hidden diseases. But what most people never hear about is that these results are extremely sensitive and can be influenced by your daily habits, your diet, your lifestyle choices, and even something as small as what you drink when you wake up. And that is why today, I want to share with you the 5 most critical things you should never do before a blood test if you want to protect your health. Avoid confusion and give your doctor the clearest, most accurate picture of what's happening inside your body, because these mistakes are common. They are overlooked and they can be dangerous. The first mistake that many seniors unknowingly make is drinking coffee, tea, juice, or even a small snack before their test, because people assume that if they avoid heavy meals, a little drink won't hurt. But here's the truth. Even black coffee without sugar can stimulate your digestive system and liver, increasing glucose production and affecting your blood sugar readings, while tea and juices can alter hydration levels and enzymes, meaning that what your doctor sees on paper might not reflect your true health. And instead of receiving a simple reassurance, you may leave the clinic with unnecessary worry or even a prescription you don't need. The reason this is so dangerous for older adults is because after 60, blood sugar control becomes more delicate, and any artificial spike caused by caffeine or fluids can mislead your physician into thinking you are pre-diabetic or experiencing abnormal fluctuations. So the safest rule is to follow fasting instructions strictly, which usually means drinking only water before your test, nothing else. The second mistake, and this one surprises many people, is exercising right before your blood test. Because while we often hear that exercise is good for the heart, muscles, and metabolism, doing it within 24 hours of your test can temporarily change the concentration of enzymes like creatine kinase and lactate dehydrogenase, which are released when your muscles are active or slightly strained. And for seniors, this can mimic the markers of a heart attack, muscle injury, or liver stress, creating panic when there is no real problem. In fact, some doctors have shared cases where patients rushed to the emergency room with alarming lab results, only to later realize that the person had simply gone for a morning jog or done heavy housework before their blood draw. And that is why the recommendation is to keep your body calm, relaxed, and in its natural state for at least 24 hours before any major test, especially if you are being checked for heart or liver function. The third critical mistake involves medications, vitamins, and supplements, which many seniors take daily, often in the morning with water. But here's the catch: certain pills, particularly biotin, vitamin C, iron, herbal capsules, and even common painkillers can interfere with hormone levels, thyroid readings, and iron counts, producing false highs or lows that completely confuse the doctor, leading to additional tests, wrong treatment, or unnecessary changes in dosage. What most people don't realize is that some supplements linger in the bloodstream long enough to alter results even if you take them the day before. So the safe practice is to always inform your doctor about what you are taking and ask whether you should pause them before your test. Because in many cases, stopping for 1 or 2 days can give a much clearer, truer picture of your health. And this becomes even more important for seniors, whose bodies process drugs and vitamins differently than when they were younger. The fourth mistake is often overlooked because it seems harmless: not drinking enough water the night before or on the morning of your test. Because while many people focus on fasting, they forget that dehydration thickens the blood, making it more difficult for the nurse to draw, which not only causes discomfort and bruising, but also alters the concentration of red cells, electrolytes, and kidney markers, tricking the lab into reporting signs of dehydration or kidney problems that may not truly exist. For seniors, dehydration is already a common risk because the natural sense of thirst diminishes with age, and medications like diuretics or blood pressure pills further reduce water levels. So if you skip water before your test, you're almost guaranteeing a result that misrepresents your real condition. And that is why doctors recommend drinking plenty of plain water, just water, not juice or flavored drinks, throughout the evening before, and even up until your appointment, unless told otherwise, so that your veins are hydrated, your sample is clean, and your results are accurate. The fifth mistake, and this is one almost no one talks about openly, is smoking or being exposed to smoke before your test. Because nicotine and carbon monoxide in cigarettes or even secondhand smoke can distort oxygen levels, increase white blood cell counts, and affect cholesterol, making it appear as if your lungs or heart are under unusual stress, when in reality, the disturbance is only temporary, and yet the doctor, not knowing that you smoked before the test, might recommend further examinations for lung disease, heart problems, or circulation issues. This is particularly harmful for seniors over 60, because many are already being monitored for respiratory or cardiac conditions, and a false spike in their results can set off a chain of unnecessary X-rays, scans, or medications, all because of a cigarette smoked at the wrong time. Now, let's put this all together. Drinking anything besides water, exercising too close to your test, taking supplements or medications without checking with your doctor, failing to stay hydrated, and smoking before your blood draw may seem like small, everyday actions. But for seniors, they are powerful enough to change numbers on a lab sheet, numbers that your doctor depends on to make life-changing decisions about your treatment. And by avoiding these 5 mistakes, you give yourself the gift of accurate results, a true understanding of your health, and the peace of mind that comes from knowing your doctor is working with real data, not distorted figures. Imagine the difference this makes. Instead of worrying about being told you have diabetes when your sugar is only temporarily elevated from a cup of coffee, or stressing over heart damage when the only cause was yesterday's exercise, you leave your appointment with confidence, with clarity, and with the security of knowing that your health is not being misrepresented by preventable errors. And that, my friends, is why every senior should take these warnings seriously. Remember, your blood tells the story of your health, but it is up to you to make sure that story is told truthfully, without interference and without mistakes, because in the end, the best medicine is not only in the pills we take, but also in the choices we make before the test, the small decisions that guard our health and preserve our golden years with strength, dignity, and peace of mind.